to the Autism News NetWORK. My name is Joshua, and I'm here with Kyle Kilvington, and today we will be interviewing Dr. Boyer. She is a child and adolescent psychiatrist at MUSC, otherwise known as the Medical University of South Carolina. She has a heart for autism, and we are thankful that she has taken time out of her busy schedule to let us interview her. I will also be joined by Dr. Gwinnett and Miss Aaron. So let's get started, shall we? I know it's early. It's at the time of this recording, it's 9:20. So hopefully everyone's awake and feeling good. All right. So the first question for Dr. Boyle is where are you from originally?
I am from Raleigh, North Carolina.
Dr. Boyer, what is your role at the MUSC?
So I'm a child and adolescent psychiatry fellow. So I just started my second year of training and the last of many.
Where did you complete your undergraduate in medical school at, if you don't mind us asking?
Of course. So I went to Duke for undergrad and Wake Forest for medical school. And then I went to Emory for residency, and then I came here.
Where's that last school at?
Emory is in Atlanta.
Dr. Boyer, did you ever witness bullying against a loved one?
Yeah, unfortunately. So my little brother has autism. He's 26 now, so he's an adult. But I guess I should start by saying he is, autism is a spectrum, and he is definitely on the lower functioning end. So he is largely nonverbal, can say a few words, but mostly noises. And so a lot of bullying I witnessed was probably when we were both kids, and families would be over at each other's houses, and so the kids would be, say, in the den watching TV. He would be making a lot of noises or flopping his hands, and my peers had never heard of autism. I mean, my family hadn't until Corey was diagnosed, right? And so they'd say like, "Oh, can you make him be quiet? Why can't he just stop? Corey, shut up," that kind of thing. And they didn't mean it in a bad way. They just thought there's this kid who's making noise while we're trying to watch TV. And so I don't know if that's bullying, I guess, because they didn't really know what they were doing. But it was definitely, hard for me at times and could definitely be hurtful. So I just kind of had to learn, sometimes it really got to me, and other times I was able to kind of move him out of the situation and just kind of take us to do our own thing.
How did your family cope with the challenges when your brother were growing up?
Well, that's a good question. And, I think every family is different, and every, family's challenges are so different, kind of depending on the individual with autism and their needs and their abilities. But I think that the main thing we all kind of learn from it is just you have to stick together. I think it's easy when there are challenges, especially when, we can't directly address Corey about them, or he wouldn't understand what the issue is, for us to kind of all go at each other. And so I think the most important thing in dealing with the challenges was remembering that we're all a team, even if we don't have the answers, and we have to just work together. I think an added challenge is, obviously, I was a kid too at for much of this. We're about 3.5 years apart. So I think my parents all had the added challenge of, including me and, being honest with me, but also remembering that I was an adult and might not be able to handle all of it. So I think that was a different challenge for them that, I think they did a really good job at. But yeah, kind of working together as a team, and also just kind of for them what they could do, knowing that I was a sibling and not another parent.
That leads into the next question I have for you, Dr. Boyer. I assume by you having a brother with autism that helped develop your heart for autism. How did you exactly develop it?
So it was just always a big part of my life. Growing up, every Saturday we went to this art and music therapy program for kids with autism that my brother did. And so I started volunteering in that when I was in elementary school. Not that I'm really artistic or musical, but I would kind of sit in and try to help. And so it was just always a big part of my life. And so it's just kind of natural. It never really felt like, oh, I'm choosing to have an interest in this. It was just part of my life.
That's good to hear. So let me ask a question. let me go off script for a little bit, if that's all right. Because I know for me growing up with autism, I'm 33, so when I was a kid, and everything, people really didn't know that much about it, and it was always assumed that it was almost like pregnancy. You either had all the symptoms or you didn't. And the ones that were high functioning, like myself, it kind of fell through the cracks, and So how would you say? Because I don't know how old your brother is, but would you say that how do I want to say this? Would you say that played a role in him growing up? I mean, did y'all have resources? I guess I'm trying to say, or were y'all more or less had to figure it out on y'all's own, like I did?
Yeah, I mean, I think
my mom did.
I think, so Corey's 26, but I think, when he was younger too, nobody really knew what it was either. My family certainly hadn't heard of it when he was diagnosed, in the mid to late 90s. So, I think we found a lot of helpful resources along the way, but I agree, a lot of it you kind of have to navigate. And even if you're trying to get resources, what are the resources? The resources Corey needs are probably different than the ones you needed because you were so much higher functioning. So yeah, I think it was a lot of guesswork. And I think one of the great things now, for instance, with projects like this is, I think people have heard of autism now, because of projects like this and other awareness campaigns. And so at least there's that, right? And so
Right.
whether you're lower functioning or, as you said, higher functioning and maybe not, meeting every criterion, you're still being able to hopefully kind of get more understanding now.
Yeah, I feel like it is improving. I mean, we still got ways to go to start
definitely.
as far as figuring out, but it is definitely an improvement especially from when I was a kid.
Yeah, I bet. And I think you're totally right. There's still a lot of room for improvement.
Since we're on the personal experiences, how has your personal experience with your brother helped your medical practice?
Well, I hope it's helped. And I hope it's helped make me, a more empathetic provider, right? So now I've known the role of family member and I've known the role of doctor. And so I hope that when I'm in my doctor role, I'm able to kind of remember what it's like to be a family member, remember the questions I had, the uncertainties, the stressors. And so just try to help families from, kind of, my medical background and a place in my heart. Just even little things like questions maybe I had that they're not asking, but I think they're going to have,
Right.
Yeah, so just trying to meld those two as best as I can.
Yeah, because there's some things that you just can't learn from a textbook that that having personal experience, either as a family member or as on the spectrum, you just can't really get from a textbook, in my opinion. Wouldn't you agree?
Definitely, I think you're totally right.
I know that you said at the start of this that you were at you're at the medical university. What are your career aspirations as far as the future goes?
So yes, I'm finally really having to start to think about this for real after so long. But I think I enjoy outpatient care the most. So I'd like to work, with children and adolescents. General psychiatry, outpatient, but I would also like to specialize in autism. I think that's something that I'm still really interested in and it still means a lot to me. And then the other thing is, the great thing about psychiatry is that, we do adult training first, right? So just because I've done child training doesn't mean I can't see adults. And so the plan is, definitely for my patients with autism, but I think probably for all of them, if they come to me as children and then they get older and they become adults, I can still keep seeing them. And, I think that kind of continuity is really helpful, especially in something like autism, where I think a lot of, adult providers don't really specialize in that. But I think it's great that it's not like we're pediatricians where there's this age cutoff and you got to get out of here, right?
Right.
And so I would really like to just be able to keep seeing my patients across the lifespan, regardless of their age.
Yeah, that would be good, because I know for myself, I don't really do good with changes, even small ones or even big dramatic life changing ones either. I do better with consistency.
Yeah, I think that's a great point, right? To not put individuals with autism through some unnecessary change like that, especially when it comes to their medical care.
Exactly.
So, looking far into the future, Dr. Boyer, do you worry what will happen with your brother when your parents pass on?
Definitely. So that's been a huge topic in my household for the past several years. And I think the thing about that one is, my parents have made, really unbelievable efforts in working towards a plan. But just because you put in the effort doesn't mean that a plan materializes. So things are really up in the air right now. I think we know he's going to need to live with someone who can care for him. Whether that's a group home, whether that's with me, it's really unclear. And I think when you're looking at these homes, you have to, one, think about kind of, does it suit that individual? Like, we looked at a couple that they're actually based on farms and he really loves the outdoors. So that would be a great option. But then also with someone like Corey, the other thing to think about is, he's not, he's barely verbal. And so that makes him, unfortunately, a really easy victim for mistreatment, right? So we need to put him in a place, if he goes elsewhere and not with me, it needs to be somewhere we trust so much, because he can't tell us if he's being mistreated. So I think that adds another layer of complication to where he would go. So I think at the end of the day, there's a great chance he's going to live with me, which I think will present some challenges, but I think whatever situation makes him happy and healthy is what we need to do.
That sounds really good. What would you tell the parents of a 13-year-old with autism about how they can best help their child prepare for adulthood?
It's a great question, because I think it's something I'm going to encounter a lot in my medical practice as well. I think just saying, really pay attention to, one, what makes your kid happy, and two, what their abilities are, and kind of plan from there. And then, really just make sure that you've got, the things ironed out for their adulthood in terms of like, do you think you're going to need to take guardianship when they're 18? Because that takes a lot of planning and can be really important. Starting to think about things like, are they going to get a full high school diploma or a certificate? What is their ability there? Even thinking about like where they might live when they're adults, even though that's far out. And then also, I think we all have this tendency to like look at the future and have trouble just being present. So remembering that your kid with autism is here now, and
Right.
being the best parent you can be for them right now.
Yeah, I would definitely agree. It's never too early to start planning for for the future if you have a child with autism, because it'll be on you before you know it. And it's when it comes to getting help from the government, it takes time to fill out the forms. It takes time to get authorization and approval. So I believe in my personal opinion, I believe that it's never too early to start planning for that, because it will be on you before you know it, unfortunately.
Especially if the child is going to be, or adolescent is going to be, one of those who cannot go out into the working field because of their autism. Getting them on disability is a difficult process.
Yes, it is.
My mom actually achieved it way back when, but I personally am 100% disabled according to the government. So I don't know if I'd ever actually be able to work at a job. I'd have to volunteer places.
And enter the Autism News Network, because Kyle and Josh are already working. They're cutting a podcast right now. What are you doing? And our goal is to create the Autism News Network to be a job source for adults like Kyle and Josh, so they can get paid for doing this awesome work.
Dr. Boyer, let me just wrap this up. What do you think of the Autism News Network?
I think this is the coolest thing. I really haven't seen much like it, but I think it's a really wonderful project. As Dr. Gwinnett said, it does it supplies jobs and teaches skills, and then also allows for a community to be formed around this, and bringing together like-minded people, and then individuals with autism who connect with one another. I just think it's a really great and unique project, and I hope we see things like this pop up elsewhere.
Now, I know last week, what was it? It was either last week or 2 weeks ago. I know we interviewed some people out in, I think it was Houston, wasn't it, Dr. Gwinnett, that's doing something similar.
Yep.
That would be we'll post the link to it and the YouTube link in the comment in the description below on the YouTube channel. But it's for people to watch that one. But yeah, it's we definitely need more programs like this. So as we wrap this interview up, does anybody else have any questions, like Miss Erin or Dr. Gwinnett or even you, Kyle? Or do you even you, Dr. Boyer, do you want to ask us any questions?
I had a comment, and for some reason I'm thinking of Dr. Boyer and I'm picturing her as a tree, and she's been kind enough to share her roots with us. And then she's a tree that's of course growing towards a very fruitful career, and she's almost completed her training now. And I'm just thinking, based on her roots and her family and her personal experiences, how many patients and families are going to benefit from her firsthand experience? You know, how many families will seek out and receive shade from that tree based on Dr. Boyer's experience and her hard work and dedication in this area. So we wanted to just acknowledge that and thank Corey, who's not on the podcast, but just for being who he is, because he's helping his sister help others. So shout out to Corey.
Yes, I think that's a great point. I don't think I would have been in this career without him.
This has been the Autism News Network with myself, Joshua Miller, and Kyle Kilvington, saying, signing off and saying, have a great day.
Thank you so much for having me.